Welcome back to our channel. I'm Dr. Dan Eli, an EQA consultant gynecologist working with Bloom Women Health. We've been discussing a very important thing in our mom and baby fair in our hospital, and one of the common things which I take it as a very serious issue are danger signs in pregnancy. In pregnancy, there are so many things, presentations mothers encounter. Some are not unusual, and because they're not unusual, I do not want usually my mothers to refer to them as normal, because there's nothing like normal. For example, if you're having headache, and yet we know headache can happen in pregnancy. We know that mothers who are pregnant, they can also get things like heartburns, because generally when you're pregnant, the hormone progesterone slows down your gut, so your absorption is reduced, and therefore the contents of your stomach can be able to evaporate back into your esophagus, and you feel that it has its heartburn. We know that pregnant mothers usually they get constipation, because, as I said, the stomach is usually very slow. So these are all things which can cause a discomfort. Some have leg swellings and stuff like this. So what are the important danger signs that we need to look into? So if you're a mother, for some reasons you have been constantly feeling weak, you're having headache, and you see that your hands are getting more white, what we call a pallor, or you're getting pale, it is very likely that you might be having anemia. Anemia is a very dangerous thing in pregnancy, because once you're anemic, it means that your oxygen carrying capacity to the baby is limited. And when baby does not have a sufficient oxygen carrying capacity, it can lead to intrauterine growth restriction, meaning that your baby won't grow as it should be, and that may be very dangerous for the baby. And even in some circumstances, some mothers have become so anemic to the extent that they end up losing their babies intra-abdominally. So if you see that you're very pale, it is a very serious danger sign, and that is why we encourage mothers to start clinic early, so that we can give them iron supplementation, because we know that in some societies, the kind of foods the mothers eat may not be able to provide them with sufficient iron. And we know that because pregnancy absorption is impaired and that demand is increased, therefore we need to put mothers on iron supplementation as early as possible. We also have situations where the mother can have headache. As I told you, mild headache at times can happen in pregnancy. But if you're having headache that is unretractable, even when you rest, or when you drink a lot of water, or even at times when you're taking paracetamol, that is a very serious danger sign, because it can be that you're anemic, as I said before, but there's also a possibility that you could be having features or central nervous system features of severe preeclampsia. Preeclampsia is a condition where usually the mother develops high blood pressure during pregnancy, and therefore because of that we want to ensure that we take seriously presentation of headache in pregnancy. Another danger sign is bleeding. In my previous slides, I've ever talked about bleeding in early pregnancy, but also in late pregnancy bleeding occurs. When you're having bleeding, it is a serious thing. It may mean that there's a risk that your baby wants to come out. There may also be a possibility that your baby placenta has detached from the uterus, and that is what is called placenta abruption. It can be extremely more dangerous. And then it may also be that maybe your placenta is low lying. So usually when you have a problem like that, it is very important that you need to get to the hospital so that we'll be able to identify the exact cause of the bleeding in pregnancy. Of course, at times there are some mothers who maybe have fallen in the bathroom, or there are those who fall while they're walking. If you bleed, if you realize you're that pregnant and you're falling on your tummy, it is always extremely very important that you need to do an ultrasound to see if the baby is affected in one way or the other. Because failure to do that will be able to have very severe consequences. Another very common danger sign we have are reduced fetal movement, or if there's an excessive fetal movement. So generally, if a mother feels that there's a reduced fetal movement or no fetal movement at all, it is very obvious that there's something wrong with the baby. And in that case, usually we encourage the mother to be able to get to the hospital. If it is reduced fetal movement, at times I would encourage you to get a watch and time consciously. If you can get like about 6 kicks or movement in 2 hours, that should be able to inform you that actually there's nothing wrong. Because at times we think there's a reduced fetal movement, but when we consciously concentrate, you find actually there's nothing wrong. And then opposite to reduced fetal movement or no fetal movement is excessive fetal movement. Excessive fetal movement can also be a sign that there is what we call intrauterine hypoxia. Either the baby is not having sufficient oxygen or something is wrong with the baby. So it is very important, either amniotic fluid levels are so low or something is not correct with the baby. So we usually encourage the mothers to get to the hospital so that we do a scan and what we call biophysical profile. There we want to look at the breathing movements of the baby, we want to look at amniotic fluid, we want to look at the gross movement of the baby, and we want to look at the tone of the baby. So it's a very important thing that when there is a reduced fetal movement or there's no fetal movement at all, which can be maybe either you've had an intrauterine fetal death. So it's always important that we need to get to the hospital so that we'll be able to identify the exact cause of the reduced fetal movement. Next, about also closer to fetal movement usually is if there's abdominal pain. If there's abdominal pain which may be crampy, on and off, as I said before, it may also be another sign that maybe you are having a threatened miscarriage, or if your baby is big enough, may suggest that you have what is called preterm labor. And so usually when you start experiencing that, we encourage you again to contact your doctor. And if it's a preterm labor, because we know the baby's lungs may not be mature, at times we may admit you and give you some oxygen, to give you some medicines to mature the lungs of the babies, and try to stop the cramping until, if possible, we can be able to extend the pregnancy at least to 38 weeks, and that way would be able to help you. And some of the causes of abdominal pain may also mean that maybe there's a bleeding, intrauterine bleeding, maybe the placenta is detached, what I call as a placenta abruption. When you have placenta abruption, usually the mother tends to have some kind of abdominal pain, which is hard, and at times you find that the fetal movement, rather the fetal heart, tends to start to go low, and that can be a very serious emergency for us, the obstetric team. So when you have abdominal pain, it's also a sign that you are in danger of carrying the pregnancy. Another danger sign, which happens not quite often, but it happens, are convulsions. Convulsions are seizures. The mother tends to go into fits. It can be a complete tonic-clonic seizure, or it can just be focal seizures. So when you have that, you always need to get in touch with your doctor. The commonest condition that causes convulsions, and to us we fear most, is what is called preeclampsia, severe preeclampsia. And in this case, usually the mother's pressure may be extremely so high. The mother may also be swollen, and in this case the mother may have very high BPs. And when the pressures are high and it's not well controlled, at times it can lead to convulsion. And the problem with preeclampsia is that it does not only cause the pressure being high, but it damages the kidneys and the liver of the mother. That is why mothers who have got a severe preeclampsia, usually see they have a lot of proteins in urine. They start becoming edematous, meaning that they're puffy, and then some of them they have a liver injury. In this case, their clotting systems get affected. So that's why when you have history of when you convulse and have a fit, especially if you are not known to be epileptic, it is a very serious danger sign for us, the obstetrician. So we encourage you to get to hospital as quick as possible. That way we'll be able to rule out if it is preeclampsia, or if it is low sugar levels, or if we look for other causes of convulsion which can happen. Even malaria can lead to somebody having convulsion. So we need to rule out what exactly is causing it. Is it something treatable, or is something which needs emergency delivery? So that is a very, very important danger sign to us. Another danger sign is breaking of water. So when at times water breaks suddenly, it is not a good thing in pregnancy. If it breaks when the baby is mature, we call it a premature rupture of membrane. The challenge with early rupture of membrane before labor is that at times you can be able to drain all the water, and then the baby starts pressing on the cord, which can cause distress to the baby. And then in some situations it also exposes the mother and the baby to infections, because if it is so early, we would have loved to delay, but it becomes very difficult to delay delivery, because once water has broken, and then it becomes the baby is now kind of like an open cavity. Even if the cervix is closed, but once the membranes are broken, then there's a risk that the mother is going to get an infection which usually called as a chorioamnionitis, which is not very good in pregnancy. So that is a very serious danger sign, which we always take a lot of interest in, because even in some situations when water breaks like this, you find the mothers who are already in labor, you find their cord, the baby's cord comes in front, and usually when the baby's cord presents what we call as cord presentation, it can be a very dangerous thing to the baby itself, because when the head is trying to follow up the cord, at times it presses the cord, and then the baby ends up dying because of insufficient oxygen. So another common danger sign in pregnancy is swelling of the face and hands. And when that happens, as I told you, most times we relate it with it can be that you are anemic, but it can also be because you have the preeclampsia, because I told you that in preeclampsia generally the disease kind of affects the kidney function. In the process, you start passing proteins in urine, and when you start passing proteins in urine, it means that the blood proteins becomes reduced, and when the blood proteins are reduced, then water starts draining into the tissues, and that in itself affects the mother in a very substantial manner. So that is why we need to take note of all these danger signs. So I told you the common danger signs we have are if somebody is having a fever, if somebody is having facial puffiness, or the hands are swollen, if somebody has convulsions of it, if water's broken, if you have reduced or absent fetal movements, if you are having abdominal pain, all these are danger signs which I've talked about. And then every time you pregnant, usually we give you antenatal books. Some of the books usually have notes. They have writings about danger signs. They have writings about the diet. They have danger signs about so many things. So usually it is very important that you also need to be able to read some of the danger signs. For those of you who have never subscribed to my channel, I kindly request you to subscribe to my channel. You can share my video with your friends who are pregnant so that they can be able to benefit from this information. We don't want a situation where somebody is pregnant and does not understand what danger signs are, and then that way they can be able to, help themselves at the shortest possible time. I'm Dan Eli Aniku, Bloom Women Health. Please like, share, and subscribe in my videos. Thank you.